One state we've been reporting all week that has been dealing with a major surge is Mississippi. Joining us tonight is Dr. Ijlal Babar, Director of Pulmonary and Critical Care at Singing River Health System. That's on Mississippi's Gulf Coast. Doctor, thanks so much for taking the time.
Thank you for having me.
Our own Elwin Lopez was in Mississippi getting a look at the emergency tent hospital opening in Jackson to deal with this surge. Doctors there told her they feel like, and this is a quote, "we are beyond disaster." Doctor, state officials have said the hospital system in Mississippi is on the brink of failure. Do you agree, first off? And then does your hospital system have the resources it needs, including enough workers?
Certainly we are in a more dire situation than we've been in before. Certainly more dire than it was last year, even at its worst. As far as resources are concerned, we are stretched very thin in terms of ventilators. We're also, I think our biggest need right now is nursing staff. We are very short of nursing staff.
Your governor there, Mississippi Governor Tate Reeves, reiterated Wednesday that the state would not have a mask mandate. We know the two best tools for preventing the spread of COVID, vaccines and masks. You're a doctor, you know that. So what do you have to say to those who are critical of mask mandates?
I would say that they look at the evidence. I think there is evidence that masking does cut down transmission. I think that's what they have to go for. I know the governor has stated that, but I also think the governor has given institutions the right to decide if they want to impose masking. For example, some of the school systems have been able to do that. And I think that's really important at this time.
So the surge we're seeing now is largely of the unvaccinated and thus more preventable in theory than the previous surges we've seen. From a personal standpoint, though, how are you doing and how is your team coping with this? It must be exhausting.
It is exhausting. We spend a week in the ICU per intensivist, and by the end of that week, we are completely drained both emotionally and physically. We work in a team with our nurse practitioners, and so are they. But more than anything else, it's our nurses and the respiratory therapists who basically do this day in and day out. And I'm actually more worried about them.
Well, you've done a lot of research into vaccine hesitancy. This leads into the next question. You've said some patients would rather die than get the vaccine. And sadly, we're seeing that happening. Only roughly 35% of Mississippi adults are vaccinated, 35%. Why do you think the messaging from doctors like yourself just isn't getting through?
Phil, I think it's because there are multiple sources where people are choosing to get their information from. I think that social media creates a narrative, and people can choose whichever narrative they want to hear. But I think that is influencing people greatly. I think in many cases it overrides what the physician has to say.
Doctor, what's your message for the rest of the country tonight?
I would say that, don't think that this is just like the previous surges. This is much worse. It's a surge that affects the younger population, and it has devastating consequences. Just a month ago, we didn't know this was going to happen, and now that we're in the midst of it, it's probably the worst that it's ever been.
Oh. Dr. Ijlal Babar, thanks so much for your time tonight. Stay safe, and you and your team, stay strong.
Thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.